Hi everybody, welcome to our CPC module on the nervous system chapter today. Let's move on to the central nervous system and the peripheral nervous system. So as we begin, the CPT Manual lists the various procedures that are being performed in the nervous system. So please go through the prior video sessions on anatomy so that you have a fair understanding of the entire central nervous system and the peripheral nervous system. Now what I have given here is just an outline of the services and the procedures that are being listed in the CPT manual in the same order. Kindly make a note of all of these. These are highly technical terms where you need to have a fair understanding of, or at least a basic understanding of these procedures so that you can select the appropriate codes under this central nervous system. First thing that we need to know is, the CNS comprises of brain and the spinal cord. So we all know that the brain is there in the head region, and the bones that form the head region, we call them as the calvarium or the skull. There are like 8 bones. We have this frontal bone, the parietal, the temporal, the occipital, and the sphenoid and ethmoid. We know that the parietal and this temporal bones are paired. So in total, we have these 8 bones that comprises the cranial bones. So what happens is, if the provider wants to make an incision into the bone, he makes an otomy or an osteotomy. So that we call that as a craniotomy. So craniotomy is a surgical procedure in which the physician is going to make a cut into the bones, especially the skull bones, and he replaces with a temporary bone graft.